Hello and welcome. My name is Tara Tonini. I'm a licensed acupuncturist based in Brooklyn, New York City. This is a 10-minute presentation on how TCM, traditional Chinese medicine, can support every stage of pregnancy and birth. This is me, Tara Tonini. As I mentioned, I'm a licensed acupuncturist. I hold a master's degree in Chinese medicine and a specialization in Chinese herbal medicine. My introduction to this very ancient medicine happened while working in the fashion industry. I was visiting our office in Hong Kong and became very sick on the flight. And the beautiful women in the office took me to see the TCM doctor, and I've been using Chinese medicine as a patient ever since. Now, there was a little space in between going from the fashion industry to medical school. And that time in between, I was staying very busy supporting pregnant people and their families through prenatal yoga and birth support, known as a doula and postpartum chef. So back in the early 2000s, you could find me running all over New York City, helping pregnant people and their families have happier, healthier birth outcomes. So naturally, I wove these two passions together, and this is a specialization in my private practice. Many people come to New York or are living in New York to further advance their careers and live beautiful lives. And therefore, the average age of a first pregnancy is a little later in life at 28.9 years old. For a variety of reasons, our cesarean birth rate is higher, and 1 in 5 women experience postpartum mood disorders. Now, Black women are 4 times more likely to die from pregnancy related causes than white women. And Chinese medicine can offer many accessible tools to mitigate all of these challenges for women navigating fertility, pregnancy, birth, and postpartum uniquely here in New York City. Let's talk about how and why. These are the 5 phases of care. During preconception, I like to see my patients 3 months before they're planning to conceive. If there's a male partner, we're going to treat them as well. In these treatments, we focus on regulating hormones and the menstrual cycle, and there is a lot of clinical statistics on the safety and efficacy of acupuncture for the egg retrieval and freezing process, as well as IUI and IVF procedures. In these treatments, we're also going to address stress levels and improve quality of sleep and really prepare the body through circulation and optimizing the outcomes for a healthy and viable pregnancy. The first trimester consists of weeks 1 through 12. If you've watched a Hollywood video or been around a pregnant person, you'll know that nausea, fatigue, and emotional fluctuations tend to be lingering in that first trimester phase. And we've got a variety of tools in Chinese medicine that help with preventing any type of miscarriage, which can be really important for both the pregnant person and obviously the baby. Acupuncture offers drug free symptom relief, which can be very important to people when they are carrying a pregnancy. Now, our second trimester includes weeks 13 to 27. I lovingly call this the blooming phase. This is where the pregnant person's body is going to really start to change and shape and bloom. So, in this phase, I'm often treating musculoskeletal discomforts like back pain, round ligament pain, maybe even some sacral or sciatic pain. And then because baby is growing, there's less and less room for those digestive organs, and we can optimize digestion and really improve quality of sleep. The third trimester is week 28 through 40. In this phase, I like to reduce any type of fluid retention, known as swelling or edema. Very, very important for people who are pregnant here in New York City during that heat wave of August into September with our high humidity levels. If a person is later in their pregnancy and the baby is breech, where their little booties or their feet are down to the pelvic floor, we can use acupuncture as well as herbal medicine to help optimize the fetal position or turn the breech baby. And then around week 36, I like preparing both the birthing person and their physical as well as their mental and emotional self to prepare for the birth. Around week 38, we start doing natural labor promotion. Once the baby has come, this is our postpartum phase. And there is a very sacred and beautiful 30-day window in Chinese medicine referred to as sitting the moon or zuweizhi. In these time periods, we really nourish or mother the mother through food as medicine, herbal medicine, body work, belly banding, pelvic floor support, and so much more. I love doing in-home care during the first 30 days so that we can prioritize the woman's health and make sure not only is her postpartum a wonderful healing journey, but the way that we treat and optimize the health during postpartum is going to directly inform and impact our health trajectory in peri and full menopause. Here we're going to support the vaginal or cesarean birth delivery. And if there are lactation challenges, we can work with lactation consultants or IBCLCs to enhance lactation production and create very nutrient-rich milk supply for the baby. All right, TCM modalities, or in other words, what are the tools that I'm using in these treatments? You might be familiar with acupuncture needles. They're very thin needles, about the width of a cat's whisker. They are made out of surgical steel and are sterilized and are used only one time on different parts of the body. Herbal medicine can be taken in the body or it can be used topically. And I love the topical applications for the labor and delivery process. It really helps ease any discomforts and pains that might come along with childbirth. Cupping is used on the skin and the muscles. Same with Tui Na, which is our Chinese medical massage. Now, gua sha has become very popular in the beauty and cosmetic industry, but this is actually an ancient medicine technique where we use a very unique stone to create a scraping on the surface level of the skin. This is going to increase circulation and help mitigate inflammation, pain, and discomforts. Not to mention food as medicine. So I work closely with both pregnant as well as postpartum patients to use their food as medicine, making sure that they're getting nutrient-rich, dense meals, as well as foods that are agreeable with their unique constitution. And we use movement as medicine as well, both yoga, gentle stretching, and qigong for all phases from conception to the postpartum phase. Here, I'd like to welcome you to my practice. I'm a visual creature, so I always like to show a little video of what you can expect from my office. I'm located at 497 Carroll Street in between 3rd and 4th Avenue, just a few blocks south of the Barclay Center, where you can access every train needed, even including the LIRR. Now, coming through the waiting room, you'll be greeted at our beautifully sun-filled lit room. This is our movement room. This is where we host our prenatal yoga classes, all of our yoga for women's health, as well as our childbirth education workshops and community events. Just down the hall are our office spaces and treatment rooms. Our treatment rooms consist of a massage table, and if you're pregnant, it'll get propped up with all types of props, pillows, wedges, blankets, and sheets, so you get a very relaxing and enjoyable experience during your treatment. And then just beyond the kitchen is back to our waiting room. What you can expect from a treatment with me. We always start off with a detailed health intake. So the consultation includes a thorough intake of your health history as well as your health goals. And that could include a birth plan as well if you are pregnant. I feel the radial pulses, I look at your tongue, and put together the diagnosis for your unique constitution. From there, you receive a treatment plan, which is a detailed treatment plan on everything that you can be doing for yourself and for a best birth outcome. And then you get a really juicy treatment. Some of the things I've treated just this week are painful periods and fertility, all types of pregnancy aches and pains. Fear of giving birth is a big one. As I mentioned, I loved doing cesarean scar recovery. We've done some lactation supply, and I find it really meaningful work to help both postpartum parents. So, mom and dad came in for a little neck, back, and shoulder tune up after holding that adorable but very heavy new baby, and then mitigating any stress and anxiety in the body. If you would like to learn more about Chinese medicine and how it can help your unique health goals, you can scan this QR code or simply visit the website. On our website, we also have a wide variety of free resources, including pregnancy stretches, nighttime meditations, breathing for birth meditations. Again, my name is Tara Domini. Thank you for your time and attention, and I hope to see you soon.